afternoon.
Good afternoon.
It's everybody.
Great.
For a rainy Tuesday afternoon. Yeah. So my name is Michele, Michele Hewitt. What do you want to know? I'm boring. So I am a licensed clinical mental health counselor. I work in a group private practice out of Hickory. I'm also an adjunct professor at Lenore University. I am currently teaching 3 classes, which is crazy because I work full time. But I'm teaching an introductory to psychology class and then in the undergraduate program. And then I'm doing a practicum for graduate students in the counseling program. And I'm also teaching couple and family. I have signed on to teach diversity in the summer. And then we'll be teaching 3 classes in the fall as well. I often go around and speak to different groups, to nonprofits, to companies and organizations about a variety of topics, from geriatric care to HIV and AIDS to diversity, inclusion, and equity, all sorts of things. I love working with people. I love teaching people. I love having conversations with people. I think we don't have conversations enough. And so that's one of the reasons why when Aaron asked if I would be willing to do this, I was so excited about coming out and meeting with you all and getting to know you and sharing some information with you all for Black History Month. I'm going to tell you up front, this is probably not going to be your standard Black History Month celebration. I'm not going to talk about Dr. Martin Luther King Jr. I'm not going to talk about Rosa Parks. I'm not going to talk about any of that stuff, okay? What I am going to talk about is the effect of racism on the organized American healthcare system, okay? I'm going to do that in a way that is not so much me talking to you, but sharing some stories that maybe you don't know about or that you haven't heard, okay? These are difficult conversations to have, but I'm really excited about having them. And remember, I said conversation. So if you have something to interject, if you have a question or a comment, please don't hesitate to jump right in and give your comment or make your statement, okay? Ask any questions, okay? The topic can be heavy, can be difficult. And so I want to make sure that everybody knows that they're safe and that they feel safe in this space, whether it's in this room or out in Cyberland.
Oh yeah, can you turn and wave to them? They mentioned they were just seeing your back, so there you go. Okay, sorry.
I'll try to remember to like.
Sometimes. Okay.
My daughter, I have 3 children, 2 that are like really, really adult children. And then I have an 18-year-old that is a freshman at Butler University. She's a dance performance major. And so I tend to like do all of the things that she does. Well, this is the extent of my ballet things and stuff. So, but to make sure that everyone is comfortable and everyone is safe, I'm going to ask those of you who are here in the room with me and those of you who are in virtual land to just close your eyes for just a moment. I want you to take a really big, deep inhale. And at the top of that inhale, I want you to hold it. Hold it, hold it. And then I want you to release it through your mouth. Slowly and controlled. Good job. Good job. Another big inhale. And hold it at the top. And release it. One more time. Big inhale. Hold it. And release it. And when you are ready, when you feel comfortable, feel free to open your eyes and kind of shake it out a little bit, okay? You are safe, and we are all in this together. We're going to have some really great conversation, okay? Any questions? Anything anybody wants to know before I get started about me? I promise this is boring. Okay? All right, if you will start. So, total transparency. When Aaron asked me to do this presentation, I was really excited, and I immediately had in my mind what I wanted to do. That's been 5 weeks, 6 weeks ago, something like that. Okay, so in the 5 or 6 weeks since we had that initial conversation, I have changed this thing like 7,000 times. The latest was as recent as today is Tuesday, as Sunday night. I was still like, and literally Sunday night, I was like scrapping it and starting all over. That is the craziness that is Michele. I entitled it The Sordid History of African Americans, Race, Medicine, and Healthcare, because I think it's important for us to realize the impact of race on our organized healthcare system, okay? Somebody tell me, what happened and what were we doing somewhere about March of 2020?
Batten down the hatches.
Batten down the hatches. Why were we batten down the hatches? COVID showed up, right? So then somewhere around, if I'm not mistaken, that was in March, and we thought, silly us, we thought, oh, give it 2 weeks, 3 weeks, and we'll go back to normal. And then it was a month, and then it was 2 months. And then at the end of this whole thing, we were like 2.5 years in, right? But at some point, there was a vaccine that was developed for COVID. And there was all of this conversation about who was going to take the vaccine. And there was this big push for everybody to get vaccinated. And something that sort of floated to the top, along with a whole lot of other things that were going on in our country at the time, was the fact that African Americans were not getting vaccinated. They were not getting vaccinated. And people started to say, well, why not? Here's this vaccine and here's this COVID thing. And they said, but there is a long history that plays into why African Americans were so hesitant about getting vaccinated. And so we're going to talk about some of the reasons why that happened, okay? So I want to take you on a little trip.
You want to do it?
Either way, it's fine. Okay,
So I could have to.
yeah, okay. So, trip through history, okay? Back in the 1700s, there was an outbreak of yellow fever in America. And throughout even the early 1700s, outbreak of yellow fever was really big, was really prominent. And there was a lot of talk about why the African Americans were not getting yellow fever. Well, about 1793, the yellow fever epidemic kind of hit big time, okay? And there was this question about what was happening, where it came from, all of this stuff. So as you can see on the screen, we've got this guy named Benjamin Rush. And Benjamin Rush, he was a prominent physician in the 1700s. And he, in 1789, he started the College of Physicians. Back in the 1700s, medical school was not like what we know of medical school. It was kind of like, oh, you want to do the thing? Okay, so we're going to let you do the thing, right? You're curious about the thing? Go ahead and do the thing. So that's what he was doing. That was part of what he was doing. And so he organized the College of Physicians, which was kind of one of those first sort of medical schools kinds of things. And he was studying yellow fever. And one of his procedures in order to speak to the yellow fever epidemic was something called bloodletting. And what that was is he would open up a vein or he would open up an artery and let the person who was suffering with yellow fever, he would let them bleed out for about a pint of blood. And because with yellow fever, there was like diarrhea and all. Oh, you guys are eating. I'm sorry. There was a whole lot of stuff happening in that was not necessarily fun. So one of the things that he did was he would open up veins and he would let them bleed out as sort of a way to cleanse the blood of yellow fever. In Philadelphia, we saw a prevalence of yellow fever. Now, in Philadelphia at the time, very aristocratic, a lot of the officials at the height of the epidemic were leaving Philadelphia to escape. And so Mr. Rush himself, he got in touch with the Free African Society, which was an organization that had been created for freed slaves to help advance them, to help with medical care, to help them get established in the area, that sort of thing. Mr. Rush reached out to them and partnered with them to have the African Americans, the Black people, to stay in town in Philadelphia to care for all of the officials and rich white people who had decided to stay in Philadelphia, but who were infected with yellow fever. Okay, right? But the basis of Mr. Rush's collaboration with the Free African Society was based in a racist ideology that Black people were immune to yellow fever and could not get yellow fever. So they were required to sort of stay in Philadelphia and take care of all of the white people who had gotten sick. Now, the prevalence of yellow fever in the white community at the time was much higher than that in the Black community. But what we now know is that yellow fever, and probably the probability was that most of the Black people that were not getting infected had been infected with yellow fever in Africa from the areas where they were enslaved from and had built up immunity to it, which was why they were not getting sick. Now, this was why they weren't getting sick, but it was an absolute falsehood that they could not get sick. And so in the midst of the yellow fever epidemic, somewhere between 200 and 400 Black people died while taking care of sick white people. Okay? Kind of makes sense? Understand? Okay, next. So that's my first story. And I want to be I'm going to pause here and tell you, I want to be very, very respectful of your time. It's Tuesday afternoon. Your workday ends at like 5 o'clock, right? This is going to be an hour presentation. I'm going to try my best to stay within that, and I'm going to give you a chance to ask questions, comments, and stuff at the end. Okay, so if I start like talking really fast, because I'm from Bronx, New York, when I get excited, I start talking really fast. Just be like, slow down, girl. Okay, all right. So my next story is about this man, J. Marion Sims. Is anybody familiar with J. Marion Sims? Does the name sound familiar to you at all? Talk about him. So he is known as the father of modern gynecology. Okay, he developed what the women in the room know as the speculum, the vaginal speculum that we just all know and love. Thank you, Mr. Sims. Right. He also pioneered a surgical technique that helped to repair a vaginal fistula, which basically happened in childbirth. It was a tear in the uterus and in the bladder, and urine would leak from the bladder and be expelled through the vagina. Very, very painful. So he pioneered a surgery to help repair this fistula. In 1876, he was named the president of the American Medical Association. In 1879, I believe it was, 1880, he was then named the president of the American Gynecology Society. And in the 1800s, he opened the first women's hospital in New York. Yay! So, but let's learn a little bit about Marion Sims. So back in the 1700s, 1800s, unfortunately, women's health was not a priority. Women's reproductive health absolutely was not a priority, as women's reproductive organs were considered to be offensive. They were considered to be uncouth. They were considered to be nasty. Okay, so women's reproductive health was not at the top of the priority chart for anyone. So J. Marion Sims, like other physicians of the time, were not really interested in female reproductive health, but someone brought him a female who had fallen off of a horse and she was injured, and they were like, well, could you figure out what's going on with her? You'll hit the button. What he did was he said, okay, sure. And he took this female patient, he propped her up on a table. He made her get on all fours. He pushed her forward, and he used his fingers to open up her vagina so that he can examine her. This was the beginnings of the vaginal speculum that he then created using a pewter, the handle of a pewter spoon. He was able to fix her up, But then he got to thinking and he says, this is really interesting. And so this was his introduction into studying and being concerned with female health. So somewhere around 1845, he started experimenting with surgical techniques about these fistulas. These women were going through childbirth and they were tearing and they were experiencing these fistulas. And so he went to the slave owners and he says, if you will give me the slaves, all I require of you is that you provide clothing and that you pay taxes. And I will take temporary ownership of them and I'll do my experiments. So he took female slaves given to him as property from their slave owners. And this is who he experimented on. Mr. Sims, the father of gynecology, conducted experiments for over 4 years on slave females. He brought them on the table and inserted all sorts of instruments. He conducted all sorts of experiments with nothing to help them fight the pain. There are accounts where there are records of where he recorded how the women screamed and writhed in pain, and he ignored it. Okay? After 4 years, Dr. Sims perfected his fistula surgical procedure. 4 years of practicing on these slave women. And then he began to offer the service to white women with one caveat. They were able to get anesthesia. He never performed any of his procedures on any white women without anesthesia. In his autobiography, there is a quote where he said, this was a time during his time of experimentation. There was never a time that I could not at any day have had a subject for operation. He was given so many female slave women that he never had to worry about, would he have someone to experiment on? And we have to think about it. Why would a slave owner be so willing to give up his slaves, female slaves? Well, first of all, slaves were property. Second of all, the women were second-class property. They were not as worthy as the males, okay? But they did have worth enough that they helped to reproduce. So the slave owners wanted these women to go get fixed and come produce, okay? Dr. Sims also made comment that this was the most memorable time of his life, conducting experiments on these women. The underlying factor in all of this is the belief that Black people do not feel and did not feel pain. So although they were writhing, although they were screaming, although they were crying, it's not as bad as they sound. Now, we know from records of Dr. Sims did receive some pushback related to ethical practices. There were people who were like, this doesn't seem quite right. What did he do? He moved to New York in the 1800s and he opened up a women's hospital. He opened up a women's hospital where he had no accountability because it was his hospital and he could do whatever he wanted to, okay? We know that there were hundreds of women that he operated and experimented on. Of those, we know of 3 names. There were 3 names that were recorded in his records: Betsy, Anarcha, and Lucy. And they are often called the women of the women of gynecology. One of these women, he actually operated on over 50 times with no anesthesia. So when you look at the photo on the screen, you see the young lady that's on the table, but you also see the 2 young ladies that are sort of behind the curtain. They are representative of these 3 young ladies. Okay, next slide, please. Next up, how many of you have ever heard of the Tuskegee experiment? The Tuskegee experiment, 1932, It was originally called the Tuskegee Study of Untreated Syphilis in the Negro Male. It was an experiment that was sanctioned by the US government through the United States Public Health Service. The study itself included 600 men. 399 of those men had latent syphilis. 201 did not have syphilis. They were considered to be the control group. These men were told that they were being treated for bad blood. In Macon, Alabama, the term bad blood was a term that was commonly used to talk about syphilis, but it was also about fatigue and anemia as well. None of the 600 men were ever told that they had, or of the 399 men, none of them were told that they had syphilis. So they didn't know. If you know anything about syphilis, latent stage syphilis includes things like blindness, mental illness, serious physical ailments, and ultimately death. How were these men selected? Well, the U.S. Public Health Service solicited the help of the Tuskegee Institute, which is now Tuskegee University, to identify these 600 men. During that time, they were promised free healthcare. They were going to get medical exams, free medical exams, right? Why is that important? These 600 men, most of which were sharecroppers, most of which had never been to the doctor before. You dangle the carrot and they will come. So the part of the carrot was free medical exams. They were also offered, it was free medical exams. They were offered burial insurance. Does that strike anybody as odd?
You knew they were going to die.
Free burial insurance, right? Okay. And that they were told that they were going to be treated and all of these things. So this, again, was done without consent because they didn't know that the ones that had syphilis, they didn't know. They were given, over the course of this time, they were given aspirin, they were given minerals, and they were given lots of placebos under the guise that they were being treated for bad blood. Okay. In 1943, now, the original experiment started in 1932. In 1943, penicillin had been identified and was widely used as a cure or as a treatment for syphilis. 1943 rolls around, 1944 rolls around, 1945 rolls around. Study is still going on, and none of these men are being administered penicillin for treatment. There is a treatment readily available, and they are not receiving it. So much so that the United States Public Health Service instructed physicians in Macon, Alabama, to not treat any of these men. For just a moment, they were told, don't treat them. We got this. They didn't got this. Okay? The goal of the study was to track the disease's full progression. And in order to do that, they had to allow these to just run the gamut. Okay? Next slide, please. This young man, Peter Buxom, he worked for the United States Public Health Service. He stumbled upon the experiment and went to his higher ups and said, hey, I have some ethical concerns about this experiment that's happening. And what do you think they did? They covered it up. They shut him down. You don't know nothing. You don't see nothing. You don't hear nothing. They shut him down. Well, Mr. Buxton went and he leaked the story to the Associated Press. And the Associated Press ran the story in 1972. That's important because the study has been going on since when? 1932. 1972, the story runs in the Associated Press. When the story runs in the Associated Press, the assistant secretary of some health department thingy initiated an ad hoc advisory panel, appointed this advisory panel to research and to see if there were any ethical concerns related to the Tuskegee experiment. In their reported findings, they said, and I quote, "The study was ethically justified." Another portion of their report said the results were disproportionately meager compared with the known risks to human subjects involved. Basically, they said, it's just a little thing that's happening to these guys. It's fine. Okay, next slide. So about 1973, what was established was the Tuskegee Health Benefit. So that was early part of 1972. Later part of 1973, the advisory council came back and said, this is unethical. This experiment needs to stop. That was in about October. The experiment was not shut down until about a month to 6 weeks later. So late 1972. 1973, the government established the Tuskegee Health Benefit Program. It was established in March. It was to provide all the necessary medical care for the survivors. By this time, at least, if I get the number correct, I believe at least, I'm going to say it's something like 50-some people, so 50-some men had already died. Okay, already died with a treatment available. Okay. So they were supposed to provide all necessary medical care for the survivors. In 1975, they expanded the program and they included the wives and the children and the widows of these participants. Now, why is that important? Because way back in 1932, when it started, and they didn't tell anybody, these men were going home and they were married and they were having sex with their wives and they were bearing children, and children were being born with illnesses. And nobody could figure, somebody could figure it out, but nobody was doing anything about it. So the effects of this experiment that started way back in 1932 were having effects all the way through this time period. So in 1975, the program was expanded. And then later, in the next year or so, it was also expanded to include other health benefits and medical benefits to the survivors. In January of 2004, the last participant of the Tuskegee Institute experiment died in January of 2004. The last widow that was receiving benefits died in January of 2000. Not that long ago. As of 2022, there were approximately 10 children who are still receiving benefits from this program. Okay. Next slide, please. One more story. Anybody know Henrietta Lacks? Yeah. Henrietta Lacks, African-American woman, 1951, she was presented to Johns Hopkins Hospital with vaginal bleeding. What was found was that she had a malignant tumor on her cervix. During that time, first of all, Johns Hopkins in 1951 was one of the few hospitals that would even treat African Americans. The fact that she walked in to Johns Hopkins University and Johns Hopkins Medical Center was a big deal. The fact that they actually examined her was an even bigger deal. The biggest of the deals was that they actually did something. So there was this doctor, he found this malignant tumor on her cervix. There was another doctor, a Dr. Gray, I believe his name is, who was doing cancer research. And he had been collecting cancer cells from different patients to do studies about cancer and viruses. And so they swiped some of her cervix cells and they sent them off to this Dr. Gray. Dr. Gray realized that All of the other cells that he had received from other patients were dying in his laboratory. Henrietta Lacks cells were duplicating, were doubling in size within 20 to 24 hours. Dun, 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 dun. Amazing. We now know these cells they're called HeLa cells. They are used today still in the study of toxins and drugs and hormones, viruses. Most recently, they have been used in the development of the COVID-19 vaccine. Henrietta Lacks died not long after she entered the hospital. She was never told that her cells were used. Her family members were never notified. They were never told, nor were they compensated for all of the money that biochemical companies received from using her cells to do all these wonderful things. Okay? Why? These are the stories of people who have, Black people, who at the hands of organized American medicine been used as guinea pigs based upon the belief that number one, they were property and had no rights. And number two, that they felt no pain, that they were less than, that they were expendable. What does this mean and why is it important? Because for all of the talk that we hear and that we want to hear, that we don't want to hear, race is a thing. Racism is a thing. It's a social construct that was created to classify people based on physical attributes, most often skin color. And it was about economics, point blank. It was a way to maintain a hierarchy that kept those in charge and in power, and those that were not. Okay? It is also used as a tool of oppression and of violence. And we've seen numerous examples of that, even currently in our current state. Okay? Why is this important? What else does it mean? You know, we oftentimes believe that our biggest fight when it comes to racism is the racist. What I hope, if you don't take anything else from this, what I hope you realize after this talk today is that it is not the racist that is our biggest problem. It is the systemic racism that is infiltrated into our systems. That is the bigger problem. Because guess what? The systems that have been created that are seething with racism are self-sustaining. And they perpetuate throughout the system, whether it's education, whether it's medicine, whether it's the political system, whatever it is. It's not the racist, but it is the infiltration of racist system, racism with built in the system and in the structure. Okay? There is this thing called implicit or unconscious bias. That is how the system is maintained with racism. There was a study done a couple of years ago that investigated the role of unconscious bias in medical students and soon to be healthcare professionals, medical students and medical residents. I believe that if I'm not mistaken, this study was done in 2018, I believe it was. 222 soon to be physicians, healthcare professionals, 222 were studied. Approximately 50% of them, 2018, attributed higher pain tolerance to Black patients as compared to white patients. 2018, 2019, 2020, 2021, 2022, 2023, 2024. 50%, approximately 50% of the medical professionals believed that by virtue of my skin color, that my pain tolerance is higher, than that of my white counterparts. They believed, that same approximate 50% believed that Black people have less sensitive nerve endings, thicker skin, or that our immune systems are stronger and therefore require less invasive pain management. That's why this is important. Because if there is any one group of people that is unhealthy, the entire collective will be unhealthy. Okay, next slide. So as an example, a Black woman is 22% more likely to die from heart disease than a white woman. Is 71% more likely to die of cervical cancer, and 350% more likely to die from pregnancy or childbirth. I want that to sit. 350% more likely to die from pregnancy or childbirth. Factor in all of this goes all the way back to chattel slavery that says Black people don't feel pain. Don't feel pain. Okay? Serena Williams, when she had her first child, kept telling her doctors, I'm in pain, I'm in pain, I'm in pain. Serena Williams, amazing athlete, Black woman. Oh, not in pain. Dismissed it. So again, we go all the way back in history. We talk about there are accounts where even as Africans were being gathered to be put on slave ships, they were being described as savage, as inhumane, animalistic. And they got here to the Americas, and they were being described as, I don't feel pain. And they were now property. Lutheran Services owns this table. Does this table feel this? It's property. And then $20 a pop, right? This is my worth. I was treated as this table. My ancestors were treated as this. And so when I have a medical issue, you don't need that. You can handle it. You can handle it. Next slide, please. Black men have the lowest life expectancy of all other ethnic groups. Black men are less likely to seek health care, whether primary care or otherwise. Why do you think that is? What would be some reasons?
General distrust.
General distrust. Absolutely. Absolutely. If you are, as a Black man, know the story of the Tuskegee Institute, of the Tuskegee experiment, I feel a little iffy. I feel just a little, I don't know about that. Right?
Yeah.
Next slide, please. Black infants and children. Black infants are 2 times more likely to die in their infancy than their white counterparts. Black infants and children receive a lower level of care than their white counterparts. In the case of appendicitis, only 12% of African American children are ever offered opioids for the pain of appendicitis. That is compared to 34% of white children systemic racism in an organized American medicine. So I have 3 children. I have a son, and then I have 2 daughters. Pregnancy with my son, easy peasy. So easy that I was disappointed. I mean, literally, so easy that I was disappointed. Second pregnancy at 25 weeks. I'm sitting in the beauty shop with my mom. My mom's getting her hair done. And I'm about 25 weeks pregnant. And I'm sitting in a chair and I happened to look down at my feet and I was like, that's interesting. But I didn't want to say anything because I was like, something must be wrong with my eyes. And glasses, my contacts weren't working at the time. And I'm watching my feet swell. I'm literally watching my feet swell. I finally said to my mom, I said, Mom, my feet are swelling. Look at my hands. My hands are swelling. And she was like, oh my gosh, what is wrong? And I was like, I don't know. She was like, how do you feel? And I was like, I'm pregnant. She's like, yeah. So we leave the hairdresser. We go home and I can't breathe. I'm starting to have pains in my chest. She says, we need to call the doctor. Call the doctor. And the doctor said, I've explained to the doctor, listen, I can watch my feet. I can watch my hands. They're swelling. The doctor says, well, Michele, prop your feet up. Drink some water. It's the doctor. Okay. Drink some water, prop my feet up. Well, while I'm propping my feet, I have my feet propped up. The pain in my chest starts to hurt really bad, and I can't breathe. We call the doctor back. The doctor says, I believe you have heartburn. Take an antacid. I had heartburn. I didn't know what it felt like, so if the doctor said I had heartburn, I said, okay, I must have heartburn. All day Saturday, I'm crying because I can't breathe and my chest hurts, and I am blowing up like a balloon. Saturday night, I go to bed and I can't lie down because every time I lie down, my chest hurts. It feels like my chest is going to explode. So I sat up in a chair and I cried all night, and that's how I slept. Sunday morning, we call the doctor. Doctor says, well, I still think it's hard. You need to up your ante on the antacid, take some more Tylenol, get some rest. Okay. If you're not feeling any better, then come in on Monday. I beat the doctor to the office on Monday morning. I was there waiting on him. Walked in, the nurse looked at me and she said, come in here and lay down. And I need you to lay on your left side. And I need you to just be really quiet. And as she walked out the door, she cut the lights out. Okay. Doctor comes in and the doctor says, well, look at you. Look at me. I don't know. I'm like, I know I got this pain in my chest and I know I look like over the course of from Friday, I put on probably 25 pounds of water weight. I looked nothing like myself. Comes in, blood pressure's high. You got protein in your urine. Pain in my chest. And I'm talking to him like this. He says, well, I guess maybe we should send you to the hospital. The nurse goes, no, we're going to send her to the hospital. And she's like gathering up stuff. And I'm like, what's going on? And they're like, just go over to the hospital. Go over to the hospital. I've been diagnosed with preeclampsia, which had turned into HELP syndrome. I spent a night in our local hospital because they wanted to monitor me. They'd already made the diagnosis. They were already like, your numbers are way off the chart, but we're going to watch you anyway. So they watched me for 24 hours. I had not urinated in 36 hours. They came in and God bless this nurse. She came in and she said, they're getting ready to send you to Winston. And I was like, oh, wait, my husband's got to be here, my mom. And she was like, we don't have time for that. No. So I reach over to get the phone to call my mother, and the ambulance driver comes in. And they're like, put the phone down. We got to get you. They take me to Winston. And they are telling me that I have a 20% chance of living through the surgery. I'm 25 weeks pregnant. Now, I don't know a lot, but I know that at 25 weeks, my baby's not necessarily viable. And so I'm arguing with them through every breath that I am struggling to take. No, we can't. The baby won't make it. We don't have a choice. We have to deliver this baby because the baby basically is poisoning your system. Okay. In a matter of hours, I'm in surgery and they are giving me a C-section so that I can deliver my baby. They said I had about a 20% chance of making it. My baby had about an 8% chance of making it. They were like, you're probably not going to see her. At the time, all of these births were being done at Forsyth, and then the neonatal NICU was at Baptist. And they were like, you're probably not going to see the baby because we're going to have to send the baby over to Baptist. I wake up. I'm like, what's going on? What's going on? What's going on? And they're like, everything's fine. And I'm like, no, where's my baby? And they're like, everything's fine. Everything's fine. Everything's fine. And I'm like, listen, I need somebody, anybody, to talk to me about my baby. Finally, they go, the baby's fine. We did not send her to Baptist. She is here and she's doing well. But she's still not out of the woods. She weighs 2 pounds. And she is breathing on her own, but barely. Okay. My daughter, Jasmine, went from 2 pounds and 2 ounces to 12.5 ounces before she started to gain weight. Which could have been prevented if a doctor had said to me on Friday, come to the office. But instead, you heartburn. Come on, take you some antacid. Take you some Tylenol, put your feet up. Fast forward, years and years and years and years and years, I get pregnant again. Like, what the heck is wrong with her?
I did IB for 18 years. So yes, I am kind of like, oh, okay, here we go.
I get pregnant again. I find out I'm pregnant in November. In January, something's not right. Go to the doctor. The doctor's like, you're fine. I'm like, nope. No, we're not doing that again. Something is not right. I advocated for myself. I made the doctor examine me. I made him bring in another doctor because he kept saying, there's nothing wrong. Bring another doctor in because something is wrong. At, yes, I wasn't quite 12 weeks, right at about 12 weeks, my cervix began to open. So then I had to go in the hospital. They did what's called a cerclage. They sew it closed. I'm on bed rest. Or what I should have been on immediately was bed rest. The doctor said, you can go back to work. Go back to work. You'll be fine. I worked for another 6 weeks. And then I went to the doctor and the doctor was like, oh, you should probably be on bed rest. Okay, so I'm on bed rest. I'm on bed rest. I deliver my second daughter at 33 weeks because this time I knew what to look for. And I knew that I was not going to let anybody tell me that what I was feeling here, what I was seeing in my body was invalid. We're in 33 weeks. Now she's off at Butler University doing all this weird life stuff. It's great, right? Fast forward to 2018. My oldest daughter, my 2-pounder, calls me and she's pregnant. She calls me and she says, Mom, I don't feel good. Rib cage is hurting really, really bad. I said, your rib cage is hurting? She was like, yeah, my rib cage is hurting really bad. I said, well, what did the doctor say? The doctor said I'm fine. This is probably just heartburn, or maybe I pulled a muscle. And I said, well, honey, what have you been doing? And she said, Mama, you know me. I sit at my desk and I work. She said, I have not done anything that I could have pulled a muscle. I said, okay. Monday. She called me Monday morning and she said, Mom, I'm going to work. I said, okay. She said, okay. She called me 25 minutes later and she said, Mom, I'm going home. And she said, I think I'm going to call the doctor. Now, my daughter lives in Raleigh, but her doctor is in Hickory. And she says, I'm going to call the doctor. She says, I think I'm going to just see if they'll give me an appointment. And I'm going to come onto your house. It was like the week of Thanksgiving. She says, and I'm going to just come onto your house. And I said, okay. I said, but here's what I want you to do. I want you to call before you leave Raleigh and tell them what's going on so that they can be ready for you when you get to Hickory. Mom, they're not going to. I said, listen, don't make me have to call. Nobody wanted that. She calls and they were like, well, it's the week of Thanksgiving and come on down the road. I called the doctor and I said, my daughter will be here at 1:00. We will be at your office by 1:20. We will be at your office at 1:20. Okay. My daughter drives from Raleigh to Hickory. In the meantime, I'm having to pick up my youngest daughter. And so I said, well, meet me at the house. She comes to my house and I take one look at her and I was like, go to the hospital. She's like, what? Just go to the doctor's office right now. I'll meet you. Gets to the doctor's office. She gets to the doctor's office. By the time I get there, she's walking out. And I said, what'd they say? And she says, I got to go to the hospital. So what's wrong? The blood pressure's up. There's protein in my urine. Okay, fine. I worked across the street at the time I was working across the street from her doctor's office. I called them and I said, I'm not coming back. I'm going to the hospital with my daughter. Get to the hospital, they get her all hooked up and everything. And they're talking over her. Has anybody ever been to a doctor and they kind of talk over you? They're talking over her. They're not saying anything to her. But as they're talking, I'm sitting next to her and I'm like, so this is what that means. This is what it means. No, what are you talking about? So what you're going to do is get out of my face because I know what this is. So they come in and they're doing some more things. And my daughter looks at me and I go, this is what's happening. And this is what you're going to do. Da, 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 da. They're not telling her she's preeclamptic. They're not telling her she has HELLP syndrome. They're giving her magnesium, but they're not giving her anything for pain. I need for somebody to look up an IV because my daughter's in pain. I'm gonna need that taken care of. I need this to happen, right? They finally tell my daughter, you've got HELLP syndrome. We're going to have to deliver the baby. Nobody can go in surgery with you. Da, 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 da. She's looking at me and I'm like, it's going to be fine. 5 years ago, we're going to be fine. This is what needs to happen. Da, 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 da. A doctor walks in and he goes, what do you know about this? What do you keep? And I said, let me tell you, this baby right here was born in this situation. I know exactly what's going on. And what I'm not going to do is let you all do her like they did me. Well, you can't go into surgery. Oh, for real? Who was in surgery? Scrubs. Like I was somebody's MD, right?
The mama.
The mama, right? She had to say, as recently, my granddaughter is 5 years old. She is running amok. She is running things. She is the boss baby of any and everything, right? 5 years ago, 5 years ago, I had to fight the same fight. Skin color, because of her skin color. She's not in pain. She's fine. It's fine. Don't give her some Tylenol. We're not gonna give her morphine. Oh, I know what that pain up here feels like. My baby needs some morphine. Let the morphine drip in. Right? It's built on racist ideas. Do I have to worry about the racist? I have to worry more about the system and how the system continues to perpetuate ideas of savagery, unworthiness, lack of education, devalued. Because if one group of the collective is unhealthy, is uneducated, is whatever, the entire collective is also unhealthy and uneducated. Okay? Almost finished. Ooh, what you see on the screen. I believe that as individuals, we have to learn to advocate for ourselves and for those that we care about. All of you sitting in this room, I'm making an assumption that you all at least know each other as individuals and as a collective. As individuals, we all have to collectively make decisions about what we will stand for, what we will stand up for, and who we will stand up for, whether it be ourselves, our families. We have a responsibility as individuals. As in our interpersonal relationships, the people that you love, the people that you work with, you have a responsibility to stand up and say something. If the old gentleman had not come across the Tuskegee experiment, and when they told him, shh, if he had, shh, think about the implications of that. That's interpersonal. That's community. As an organization, Lutheran Services has a responsibility to stand on what's right. It may not be what's comfortable. It may not be what's popular. But Lutheran Services as an organization has to stand on what's right. And then, lastly, we have to make sure that there are policy changes. The only way that the systems can be changed is through policy change. And you, each of you, as individuals, as a related community, as an organization, you all have the power. We all have the policy, the power to make policy changes that change the underpinning and the foundation of racist systems in this country. That is what we have to do. Show health. I want to make one other statement. I've talked mostly about medical stuff. I'm a mental health professional. You know when I see little Black boys in my practice? Somebody tell me, when do I see little Black boys when they have behavioral issues? Far and wide, little Black boys, little Black girls, it's crazy. All of a sudden, little Black girls are being diagnosed with things like ODD. 5 and 6 years old. They're being diagnosed with RAD, 5 and 6 years old. It's never taken into consideration that little Black boys and little Black girls are growing up in a society that still continues to devalue them, and that they're being frustrated, and that their frustration shows up differently than in others. And so they're not oppositionally defiant. They're frustrated. They're afraid. They have no voice. So we wonder why men don't go to the doctor. I'm going to the doctor to tell me I'm fine. And yet we see low life expectancy. We see higher prevalence of diagnoses of diabetes, heart disease, and cardiac issues. What is the one common theme through all of those things? Stress. How many of you guys experience stress? Anybody have any stress?
Yeah. How many limbs can we put?
Right? Add to that the stress of racial inequality, fear, right? Exponential increases chances of heart disease, diabetes, cardiac issues, all of the things. But we have the power to change it if we gird ourselves up and do the work. So we ask ourselves, why were African Americans not taking the COVID vaccine back in 2020?
The government.
It was run by a government who has shown itself time and time again to disregard and devalue Black life. Gosh, Michelle, that was a downer for today. For the love of Rice Krispies, get her out of here. We have the power to change. We have to make the decision. We have to make the choice. Will we stand on what's right? Will we acknowledge it, or will we continue to deny and do what's right for all mankind? For me, that is what Black history is about. Because Black history is your history. Your history. Your history. And it's your history. And it's your history. And it's your history. And it's your history. And until we acknowledge the atrocities and the sordidness of what has been done, even your history isn't. But we can change it. We can change it. See, I'm trying to lighten you a little bit. I start to break dance. Will that help?
Definitely.
And there an ambulance on that.
Defibrillator.
That would work. That would be a start. That would be a start. Thank you so much. For everyone, I don't want to walk away and not give you all a chance to speak.
Yeah, very informative, especially about the Tashiki's experiment. I think that was like the main thing I heard of whenever I heard of, people of color, African Americans not getting the vaccine.
Mhm.
That was the one thing I think most people thought about or kept them away from getting the vaccine.
Absolutely.
Was that, that experiment. And I honestly, like over time, even like my siblings, I asked siblings that didn't want to get, like we would agree with everything until it came down to that. And mainly, older people, especially older people.
Mhm.
It's fresher.
Yeah, because they knew
They
what.
do.
They
what
was
happened.
alive when the news broke.
Yeah, and they were like in their like middle age, so they were like very well aware. They were very like, and then they're like, oh, the government. Oh, all of a sudden, like in weeks, we got a COVID vaccine. Oh no, my mother, will be 91 in April on April Fool's Day. My mother will be 91 years old. She was like, She's sitting in her chair. She's like, I said, Mama, you gonna get I said, Mama, you've got some health issues and you're up in age. I have an older sister. She's 7 years older than I am. And she suffers with anxiety really high, especially when health related stuff. My sister said, absolutely not. I will stay in the house from now until Jesus comes back.
That's why.
But that's why.
Yeah.
But that's why.
And it's sad, I know a lot of people, I think during that time, there was a lot of Black people dying from COVID. And
Exactly.
that's the sad thing about it.
Exactly. And even now in 2024, the rates of vaccination for African Americans has gone up, but it's still much lower than other ethnic groups. And African Americans are still dying.
Mm-hmm. And then start doing the promotion videos and stuff like that on BET. Say, hey, vaccine's cool, get it. And of course, I got vaccinated, of course. I
You'd be like, no.
But it's just, you could tell who was the target audience.
Yes, absolutely. Absolutely. My mom was saying, we finally talked her into getting it. It was fine. I went with her, and you guys know enough about me. I was like, my mama. And she was like, oh, Lord, it's a needle. Oh, God, it's a vaccine. By the time she realized that they had already given But even after my mom took the vaccine, my sister was like, I told y'all, Jesus come back. I'm not doing it. She has eventually gone and gotten it. But it's this underlying fear. There is this deep-seated trust, or mistrust of American medicine. I have clients. I don't in my practice. I typically don't see kids under the age of 13. I had a mom call me in tears. She said, my husband and I are going through a divorce. My daughter just lost her grandmother who was like her person. And I feel like she needs to be in counseling. And she refuses to go to counseling unless she can go to a counselor that looks like her. Counselors in my area that look like me. I was like, I don't do 12. I was like, how old is she? She's like, she'll be 12. And I was like, she'll be 12? Years from now? I was like, when will she be 12? I agreed to see her simply because she said, the only way I'm going to do this is if it's somebody that looks like me. She did not trust someone who did not look like her. Did you guys realize that most African-American doctors, up until just a few years ago, were mostly graduating from 2 medical schools? Harry and the other one is escaping me. The number of African-American doctors, although the numbers are going up, is way, way, way below. And so a lot of African-Americans are like, that's gonna look like me, not going. Distrust. All facets, teachers, firefighters, medical personnel. Because the US government has not been kind, has not acted favorably. But we can change it. Anyone else? Thank you. Anyone else?
You have some comments of,
Anyone else?
they're not questions, but they said, thank you and congratulations on your sweet, healthy babies.
I was going to jail, y'all. I promise. I was putting me at orange. Babies. Thank you
Thanks
so much. I appreciate you so much.